too loud?
It's okay. It's okay.
I like Peppa Pig.
Yeah. Believe it. Okay, I think we're live. Right, so welcome to the latest episode of the live streams that we're doing through the London Autism Group Charity. This is episode 4. We've already talked with Lola Alvarez Romano, Isel Dennis, and Robert White. And the entire theme has been about mental health and about helping the community to cope better in these very uncertain times. And today we're very, very honoured to have the one and only Kieran Rose, who's giving up, some of his time to talk with us, and hopefully we'll, get into some interesting conversations, and hopefully this is going to be useful for someone listening. So thanks so much, Kieran, for joining us.
Thank you for having me. It's a pleasure. I've been watching from a distance, so I know how useful these videos are going to be for so many people. So it's an honour to be here, to be honest. Oh,
that's very kind of you to say. And as usual, hello to you as well, James Gordon. How are you, James?
Hi there. Yeah, I'm all right, thank you. Yeah, I'm happy to be here as well.
Great. Yeah. Me too. So, Kieran, do you want to just maybe introduce yourself to the listeners? Tell us a little bit about the work that the amazing work that you do, and give us a brief. Obviously, if you give the full range of things that you do,
that would be here now.
Yeah. So a very abridged, summarized version.
Sure. Fundamentally, at the heart of it, I'm a writer. I started writing properly about autism and about myself about 4 or 5 years ago, and it was a cathartic kind of thing after my dad died. That my wife just sort of said, get it out. You love writing, so just start talking about autism, which is really where I've been on a really long journey, 20 odd years of discovery. So I started writing, and 1 million people later, more than 1 million now. It terrifies me, that number, but people are reading, and so I've gone on to do. I go on to do training and consultancy, public speaking, quite a varied. Like my day, every day is different, and working with a lot of really, really good organisations, lots of challenging organisations as well that are trying to change their ways, and so just a lot of varied mix.
Amazing, absolutely amazing. Well, thank you for everything that you do and the amazing difference that you're making. Today, as I said, we're going to talk about mental health, self-care. So how you been doing, Kieran, in terms of coping with the whole situation, your family, your children? How's it been on your side?
It's bizarre. I can't put it any other word than that. I think this is probably one of the weirdest situations that I've ever lived through. I can't think of anything that would even compare to it, to be honest.
Yeah.
And I mean, we were saying off camera just before, it's kind of like every day is a bit like walking a tightrope of kind of keeping your mental health within a set parameters of not too bad and not too good kind of thing, because it would be so easy to kind of become quite bipolar about it and really swing one way or the other. It's just a kind of, there's so much uncertainty right now, and everybody has lost control of their everyday lives and all of the normal, in inverted commas, things that they will be doing, normal for them at least. And it's so odd. It's just bizarre. I keep coming back to that word. I use that word all the time now, bizarre.
Yeah, well, it is a good word to describe it. It's totally unprecedented.
Yeah.
I mean, it is like we're living in a movie, isn't it? It's eerily similar to that movie Contagion, isn't it?
Yeah. And it's something else I've been talking about a lot recently as well. We've been flooded with kind of end of the world films and TV series for about the last 15, 20 years, zombie films and apocalypse films and things like that. And you can't help but look out your window and expect to see a zombie shuffling past or something. But it really does feel that eerie and quite creepy.
Yeah,
and
really
even going to the shop is just such an odd and unsettling experience now. And it's everybody's. You would think from a very stereotypical point of view, you would think that autistic people would be loving this because people are keeping their distance and all of that kind of thing. But there's no connectivity now, and it's everyone's keeping their distance in a sinister kind of way, and it's it's just weird. It's bizarre. I'm going to keep saying that. It's bizarre.
Yeah. It's weird, isn't it? Because you're right in that, people are very in a way. Obviously, we're doing social distancing, so we're physically very distant, and we see that. When I go for walks or when I do go shopping or whatever it is I'm doing, and I'm part of that distancing. I'm not, and that feels very strange and very real and makes me feel, uneasy. But at the same time, I've been also feeling, that we're all sort of serving a purpose. It's all sort of, we're all sort of trying our best to follow the rules or the advice that we've been given, and try to almost support each other in a greater good in this bizarre world that we're in.
Yeah.
And that's given me some solace, actually. The recognition that actually, most people, not all, but most people are, are trying their best, and they're contributing to a greater good. And I just feel like that actually can sometimes be good for mental health when you recognize that.
Yeah, absolutely. I think it's encouraging people to kind of look outside of themselves, because the whole point of social distancing is not only so that we don't personally catch COVID-19, but so that we don't pass it on to other people if unwittingly we do have it. And I think that's forcing people who maybe previously didn't think about other people to actually start thinking about their impact on other people and how we interact with other people and those kind of things. And from the point of view from the autistic community as well, I think this has been quite eye-opening for a lot of non-autistic people in terms of what it feels to be kind of forced to be isolated and to be excluded, and all of those kind of analogies that we talk about, James and I talk about all the time. Those things are happening now to people who haven't normally experienced those things. So I think there is so much to worry about right now, but there is so much opportunity here as well. And I think that's really important to cling on to.
Yeah, like it feels like a historic opportunity. Like after the war ended, there was that kind of sort of rebirth and a rebuilding of everything, and they had the National Health Service come in, massive investment and things like that. And I'm hoping that's what's going to happen. That all these frontline workers that have been underpaid for so long are going to be recognised and hopefully rewarded. And I hope that as part of that, everything will be looked at again. We spoke to someone from the nursing profession recently, who's formed a group called Neurodiverse Nurses, and that was really inspiring. The kind of organisation that they're setting up. They were setting up even before this, but it's very encouraging to kind of see what they're doing, and hopefully that will filter through for better training under the mandatory training for autism that the health service is going to have. Hopefully they'll have a much greater sort of input than I thought from autistic people within the health service itself.
Absolutely.
So that's encouraging. There's some encouraging signs, and as you say, this is a sort of great opportunity, and we have to sort of take it, I think.
I think this is a kind of time where, it's been, I'm going to use it again, it's bizarre, seeing kind of conservative MPs talking about socialist principles and values, and not communism before anybody kind of leaps on that, but those kind of principles about it not being about you personally, it being about the wider community, which is more important than you as an individual, and about everybody kind of using their strengths towards that. And that's a prime example. What happening is now happening within the NHS, care services, people working in kind of food shops and supermarkets and things like that. They're now being highlighted as the most important people in the country, more important than politicians, more important than the army or the police. These are the people that are now keeping us going. and have been all this time, but it was just hidden under a cloud of everybody else is more important. So I think if that remains, if that focus remains on those groups, it can only be to the benefit of the country and the world as a whole, really. I think we needed social change. We've needed it for a long time. There needed to be a bit of a social resolution. And I think if something positive can come out of all this awfulness, it could be that, or it should be that at least.
Yeah, absolutely, fully agree. That's such a good point. Hopefully we'll never ever take for granted the crucial roles these people play in, you know, underpinning the you know, our society, the running of it. You know, these are crucial people, and it's just great that we're beginning to recognize that even those people, those conservative MPs, the more right-wing people, you know, the ones that perhaps don't, you know, or whoever it is that may not have really sort of appreciated them as much before. It just seems across the board there's much more recognition. And that hopefully you're right that we can carry that through. Mark Chilvers, how you doing, Mark? You have put a comment there, a question. You say, what's a comment? You put there, you can't go out to blow off steam, which is an issue. It definitely is. Any thoughts on that, Kieran?
It is. I mean, especially, I mean, I'm super privileged. I live up in the northeast of England. I have a house with a garden, you know, so not only am I able to go out, and it's not a huge garden, but I'm able to step outside and take my children outside. I'm literally surrounded by houses that only have yards. So their outdoor space is like a concrete driveway. That's effectively it. So for the children living in those houses and the families living there, they've got, you know, they're so restricted on what they can do. And then for the people living in the cities, obviously, who might not necessarily have gardens, they might live in flats, especially around London and the bigger cities, you know, I can't even begin to imagine what I would be feeling right now if I didn't have my tiny bit of green outside space. And, you know, kudos to anyone that is stuck in a flat during this right now and can't get out, or, you know, might have a tiny balcony to stand out and look at. But even then you're looking at a sea of concrete. It's not like you're looking at, I can go out and hang out of my loft window and see green, and other people haven't got that. And it's just really hard. I mean, the only thing that I can say is that, again, I'm having so many conversations like this at the moment. A friend of mine was telling me that, you know, their whole family, they do karate, or they did karate before. They all went as a family and did karate classes, and now they're doing them over Zoom, over the internet, from their kitchen, which is really quite restricted. So we were talking about the fact that it's really, really good to try and cling on to some of the things that you did previously if you can replicate them in your house. But also there is opportunity here to find new ways of doing things as well, or new things to do. In terms of if you can't replicate something you did before, then maybe you've just got to put it down and put it aside, come back to it when all this is over, but find something else that's going to fill that. And getting out is obviously a major thing that we're all restricted in doing, but we are allowed out for periods of the day. The police in England have made statements to say that autistic people, if we can get some kind of proof backing up from a doctor's surgery or somewhere, if you can, a third party to say that we do need to go out and have extra time outdoors, then we can have that, and we can have that time, and we can have that evidence to show the police if you can get it, obviously, which is, again, is a privilege thing. But so it isn't like we are being locked in our houses like they currently are in places in Italy at the moment. So we still do have a little bit of freedom. But then you have to balance that with our anxiety over it as well, because it is creepy outside. It is unsettling to be out there. And even if I go and put my rubbish in like the outdoor bins and things, it feels weird to go out and do that when it's so quiet, and all you can hear is sirens and things at the moment, and ambulances and police cars. And it's just such a bizarre time to be in, but we have to cling on to those things that make us feel good. And that's, if that means having to do something indoors that you wouldn't normally do indoors, then you're just going to have to roll with it. I mean, there's no answers, is there? That's the worst thing. We can't just say, yes, do this or do that, because it's impossible for so many people. But we just have to find the things that make our hearts sing and do it in a different way.
Yeah, absolutely. Fully agree. I do. I just want to, reinforce what you're saying, that obviously it is much harder now than it previously was, but we do have some control still. You know, I mean, we have, you know, one thing, obviously, a lot of people talk about mindfulness, and you know, that's something that I think can play a big role here, in that we have some control in the moment, in the day that we're living today. Yesterday is gone, and tomorrow, who knows what's going to happen? But today we have some control. So if you can find, as you were saying, you know, some control in your current moment, your current, you know, next few hours, even, to do something that makes you happy, as you sort of lovely, beautifully said, you know, make your heart sing, you know, whatever it is, then, you know, try to do it. I wouldn't recommend catastrophizing, saying, okay, well, I can't control anything, you know, this is a complete disaster, because that, obviously, that's easy to do, that's reasonable, you know, it's reasonable to think like that under these circumstances. But if you can try to, I would say, self-talk yourself out of it, you know, try and apply some mindfulness, be aware of the moment, be aware that you do have some control, and do something that's going to make you happy. And it may not even be doing something, it could be just talking, I would say, you know, and now's the time to be communicating, talking, you know, whether it's with your family in your home, or whether it's via Zoom or WhatsApp, or whatever it is. Now's the time for us to really be talking to each other and supporting each other, right? So I do think there are some things, but obviously it's much harder.
Yeah, I mean, my wife and I were having a conversation earlier today, and we were actually talking about the fact that she has had so much more contact with friends since this has happened than she did previously. So, you know, we've got friends that live up in Scotland that she might talk to once or twice a year, but now she's talking all the time with them because she has the time to do that. And it's kind of, it's a really good time to reconnect with people that maybe that you've kind of let go. I mean, the benefit of this, in a way, for the autistic community is that we've been preparing for communicating online for a very, very long time. You know, most of us have friends all over the world that we talk to every day, and, you know, people that we'll probably never ever meet, and, you know, it will probably never happen, but we talk to and have deep personal conversations with every single day. And that's kind of that's like an arrow in our quiver kind of thing in terms of battling this at the moment. And I think other people need to take the opportunity to kind of use the social media platforms that we have, which most people use but despise using all the time because it takes over our lives. But actually now it's an opportunity for good. It's going to keep people mentally healthy to keep conversing with other people, and that's what needs to happen now.
Yeah, fully agree. I sort of just want to thank you, James, for bringing up how NHS workers are underrated and underpaid. Fully agree. Fully agree. Yeah, so thanks for that. We've also got another comment here from Lily Van Verdriet. She says, these times are challenging, but there is one positive thing. I live full time in a van, pretty isolated from the world. Usually people look down to me, but now even the police comes to me and is friendly and even acknowledge how good this is, especially in these times. For the first time, I get recognized in a positive way, and a lot of people ask me how I handle to live so isolated. I never thought that I can give advice to others. And this sort of reinforces what you're saying, isn't it? Yeah.
There's a whole irony here now that the people that have been excluded and isolated by society is now coming to us for the answers. It's the most ironic thing, but it's happening. You see it happening. It's kind of, I'm involved in running quite a lot of kind of Facebook support groups and things, and the amount of comments that, you know, are replicating what Lily said there, that people are coming to them and asking them how they've coped for so long. And but the thing I would hope that the non-autistic communities would take from this, and the, you know, people who have been privileged to have houses and all of these kind of things, that they would take from this that this is a short-term thing for them. But for some people, this is our lives. This is our every single day. And what you're feeling right now as an intermission in your life, hugely negative, hugely overwhelmed, hugely anxious. All of these things are day-to-day living for some people. So I think if anybody's going to take any lessons from this, I would hope that it would be that you need to think a little bit more about the other people in the world. and other people's situations and how you can help them and support them.
Yeah, absolutely. I mean, just looking at my own situation with my son, I'm a single parent, and my son is autistic, but he's also got a form of epilepsy where he's very sensitive to body temperature changes.
Mm-hmm.
So he used to love the outdoors, the sunshine, and for the last couple of years he hasn't been able to go out over the summer. It's too hot, and he'll just have seizures all the time.
Yeah.
So we're kind of trapped over the summer anyway. So isolating like this is nothing new to us, you know.
No. Mm-hmm.
So yeah, I sort of agree exactly what you just said. Yeah.
Mm-hmm.
Yeah, and it's nice. It's nice Lily is finding something positive as well.
Absolutely.
Yeah.
But not just the fact that it's happened, but I think it's also worth saying that Lily sort of identified it. Do you know what I mean? And processed it. And I'd recommend that to everybody as well. You know, to sort of reflect on what's going on and find something rewarding from that, something positive. Mm-hmm. Okay, we've got another comment here from Laurel Dudbridge. People are asking me how to do social without seeing people. Okay.
Yeah, and I guess that's just reinforcing what we've just said, isn't it? And what Lily said, and it's that people are now coming to the people who have been isolated for the answers, and there is no easy answer for this as well, because it's not like so many of us have had a choice in our isolation prior to this. You know, it's quite often enforced situations, like James said with his son, or, you know, other things going on that have mental health issues that have forced people to kind of have to withdraw to keep themselves safe. And there is just this huge sense of irony. It's just it's actually astounding me how many people are kind of like, oh my God, you've been doing this for years. And it's yes, we have. This is nothing new to it. It doesn't make it any easier for us, but it's nothing new, because although for many of us our situations haven't changed, the choice has been removed. And that's the thing now. This is kind of like, I'm kind of guessing, I've never been to prison, but I'm kind of guessing this is some ways towards how that feels, to kind of have all your liberties taken away and have them removed from you, kind of thing. And where, you know, they would have very, very little control over their day-to-day lives. We still do have some, like you said before. So I think it's really important to acknowledge that and recognize that.
Yeah, I think we're very privileged to have the internet.
Yeah.
I was thinking, I'm 45 now. I was thinking back when I was a teenager, there was no internet.
Mm-hmm.
You know, so it was much more isolating than it is now.
Mm-hmm.
With you know, we've got Facebook, we've got all these Facebook groups where we can interact with hundreds of thousands of different people. We can find our own tribe, and we can, you know, reach out to people and connect. You know, and that just wasn't a thing back when I was younger. So we are so lucky, you know.
I think this is a really good opportunity to reflect as well on what the parts of our lives that maybe we weren't happy with and comfortable with, and what we can do to take some control over those parts as well. I think the world is going to be a very different place after this. I think we're all going to, I mean, initially, obviously, I don't think we're all going to be, they're not going to drop the flag and say, everybody leave your house now kind of thing. It's going to happen in stages over a very long months, if not longer. And I think it's an opportunity to kind of say, well, what am I not happy with? How can I change things? What am I doing now that makes me happy? There's so many parents coming to me saying, you know, I wish we'd homeschooled a lot longer ago, because their children, you know, particularly for autistic children that have been struggling in schools, all of a sudden I have so many parents coming to me saying, my child's happy. It's like, yes, wonder why that might be. Because all those demands have been taken away. And that's not to say that it's an easy answer, but I think there'll be a lot more homeschooled children after this than there were previously. I think those numbers are going to skyrocket, because people are realizing that it's more important to have positive, good mental health than it is to have academic achievement. And you know, it should always come first. And and I think a lot of parents are waking up to that now, that the world doesn't have to be how we're told it has to be.
Yeah, and that's always been the sort of fundamental problem, hasn't it?
Yeah,
we just, you know, often follow blindly the social rules that have been laid out, social expectations that have been laid out, and really, when you think about it critically, they're not necessarily the most healthy, are they? Especially for our mental health. I mean, the example you make about children being homeschooled and how that was previously frowned upon, right? That was something stigmatized previously, but now everybody's doing it, and it's now. Oh, hang on a minute, it works. You know, it can happen. You know, you can set these things up, Google Classroom, and you know, online PE sessions, and you know, and it's just why should it be that one day it was stigmatized and the next day it's okay, actually it can work? You know, I mean, that's not right, is it?
No.
You shouldn't take a situation like this to destigmatize something, you know. I do hope that, as you said previously, when things begin to, you know, go back or enter the new world, that, you know, we can continue to reflect and not go back to the previous view of homeschooling. And also, as you say, prioritizing academic aptitude over everything.
And it's the same. I mean, the disability community has been crying at the irony at the minute of, you know, for decades and decades and decades, we've been asking if we can homework. And now and it was always an issue. It was always a problem. There was always a reason that we couldn't do it. And now all of a sudden everybody can. You know, it takes something to say. It shows how easily it can be done if you want to achieve something. And you know, I wouldn't recommend pushing the button and switching off all the factories in the world and things like that. But you've only got to look at the pollution levels, how they've plummeted. You know, there's reports of the barrier reefs coming back, and you know, the pollution levels in China have just dropped through the floor. India, Paris, all of the big cities and things that had pollution clouds that you could see from space, now you can't see those things. And it shows what a negative impact we have when we go through this social conditioning, and we come out the other side of that thinking that we have to do things in certain ways. And you know, it always comes back to, not to get political, but it really does always come back to a conversation about capitalism, and about how capitalism has influenced our lives into say that we have to have 3 square meals a day, you know, which impacts on people who are restricted eaters and want to graze all day. And, you know, all of these kind of little things in our lives are dictated by the world of employment and working 9 to 5 and all of these kind of things, office jobs and factory jobs and all of the kind of menial in inverted commas, all of these jobs that are now suddenly being recognized as incredibly important and the actual things that make the world go around. But it's all had a very negative influence on us, and it has to change. It really does now. I think it genuinely does.
Yeah, fully agree. Just to add to your point before we move on to this question, I'd say the same thing goes with just mental health generally. Again, previously we weren't really talking that. I mean, we were trying, you know, things are getting better, but in a generic sense, we weren't ever really talking about mental health, about anxiety, about coping, about resilience. But now that all of that is in the spotlight, isn't it?
Yeah, absolutely.
And I hope that also continues, that we, as we go forwards, continue to think about, you know, how we can be looking after our own well-being and prioritizing that. Okay, we have Katie McMaster here. I'll read it out. She says, "I just hope that when this crisis is over, people don't forget how it felt. We've been isolating, in inverted commas, for over a year as my son can't cope with normal life at the moment. I'm hoping that others will develop at least some understanding of our life after this." And that really reflects what you've been saying.
Yeah, absolutely. It's people need to see things from a different perspective. I think that's really what's been missing from society for quite a long time. Everyone's too busy looking inwards and not looking outwards. And we have so much to learn from each other and from people who live their lives very differently from us and have different values and have different things imposed on us that we don't necessarily, barriers that we don't necessarily have. And there's great opportunity here, and it would be an enormous shame, and I think a step back for us as a species if we didn't learn real lessons from this, and we didn't start listening to the weaker people in our society and those who are underprivileged.
What needs to happen to make sure that we do seize the opportunity? Do you know what I mean? What do we need to try and push? And any thoughts on how we can make sure or try and increase the likelihood that we do progress and this doesn't just fall away? Because it is so critical, isn't it, that we heed the lessons and that we use this as a platform for moving forward.
I think we've been very, very good at kind of plucking random people off the street and asking them to talk about themselves and their communities. But I think we need to listen to the voices of various communities, and particularly those that are kind of deemed the weaker areas of humanity, kind of the disability community, ethnic minorities, all the people that have been the poor, all the people that have been underprivileged for so long. This is showing us how important those underprivileged people are, and that actually, the privileged people have been kind of leeching off the back of them for quite some time. And I think that's the bit that kind of needs to change. It's that we need equity. It's not about equality. Equality has been kind of clouding the issue for a very, very long time. Equality, you can't have equality, but equity is fundamental to this. And I think it's up to people who are privileged and lucky enough to have a voice, people like me, people like you guys who have a platform, to keep those voices in the spotlight and to keep these people in the spotlight, to make sure that they're not forgotten, they're not lost amongst this. I think, and it's kind of, it's very easy to say, write to your MP and do this and do that. But if people are doing it very singly, it's quite ineffectual. So this is where communities really need to come together and be one voice. You have disagreements amongst that. Of course you will. It's natural. But generally, there needs to be a singular narrative running through the ideals of each community and the values of those. And, if people can come together and kind of shout them very, very loudly and not accept the things that have gone before, the social conditioning that we talked about, not just falling back into our old habits and our old lives, but actually kind of standing up and saying, no, we're not going to do this anymore. We're not going to put up with this. It needs to change.
So those with a voice, with some opportunity to really push the narrative, but also find consensus, and push it together as one rather than fragmented.
Mm-hmm. Absolutely.
Yeah, fully agree. Let's try and do that. So how you doing, Daryl? How's Daryl doing, James? Is he all right?
Yeah, he's okay, thanks.
Yeah. Is he coping right today?
He's very easygoing. I'm very lucky. So as long as he's got me, he's happy.
That's the most important thing. Okay, so we have another question here, or another statement, another comment. Liz Soper. Not sure if I'm pronouncing that correctly. Apologies, Liz.
You are, I know, Liz.
Oh, you know her? Oh, right. Okay. She says, it is happening. I have had to homeschool my autistic son for 14 months due to the double discrimination and a drawn-out EHCP experience. Kieran would know. Now we are able to help our SEN community friends and other friends that are struggling to adapt or cope with the idea of school learning at home. Lesson 1, both our mental health first and our child's mental health first. And connection, parent from the heart. Yeah, I mean, you're right. Lesson 1 should indeed be our mental health and our child's mental health. And I think the two for sure go hand in hand. If your mental health as a parent is okay and you're feeling well and you're coping and you're able to sort of push through and do things, then of course you're better able to support your child, and then of course the mental health the child's mental health follows, doesn't it? It's everything's very much interconnected, I think. Which again really emphasizes how important everyone's mental health is, because the two are totally interconnected. I'm glad you say it's lesson 1, because I do think, I mean, schools, Kieran, I don't know what you think, but schools so far, really, in my experience, doesn't seem like we prioritize mental health enough, do we, in schools? Not, I mean, it's not on the curriculum really in a formalized way. It should be. It should be right up there with, you know, all the STEM subjects and, you know, English and maths and all of the other courses. I don't understand why health isn't really, or mental health. I know we have PE, don't we? But that's very different to.
Yeah, it's not necessarily for people that don't like PE. It's not very good for mental health. But no, you're right. It's kind of the education. I mean, I used to be an educator. I was a high-level teaching assistant for a very, very long time, up until about kind of 10 years ago. And one of the reasons that I left was because I didn't like the way that the education system was going, and it had been going that way for a very long time. It's kind of, when I do any talks to kind of teachers or educational bodies or anything like that, it's kind of, I talk about the noose of the education system that's gradually tightened over time, because it's all become about teaching to tests, academic achievement. Teachers aren't teachers anymore. There's very little ability to be a holistic teacher like there used to be. It's very much not about subjects, it's about grades. And even, you know, it really, really upset me when all of this kind of started, when they were first talking about lockdown and they decided to close the schools. On the news up here, they had some 10 and 11-year-olds who were about to sit their SATs, who were crying on the news because they had worked so hard for their SATs exams. And I thought, that's all wrong. That's so wrong, because those SATs exams aren't for those children. They're for school league tables, for starters. You know, it's for the school. It's not for the child. It's not a measure of how well the child is doing. It's a measure of how well the school is achieving academically. So for any child to be so invested in an exam that's not even for them or about them, is fundamentally that's the education system broken right there. That's it, gone. You know, and that's the mentality that we have. It's kind of, I don't, you know what we said before about it's kind of, you can have all the degrees in the world, but if your mental health is so poor that you are going to be self-harming, or you're going to be depressed, or you're going to do something worse, what's the point of having all those degrees? It's utterly irrelevant. And, you know, I'm at the age of 40 now. It's taken me probably until I was 36 to realize what I want to do in my life, which is what I'm doing right now. I don't need any academic achievements in order to be able to do what I do. I don't, you know, I'm lucky I've got an English and maths GCSEs, and I have my GCSEs, but I wouldn't be able to tell you what my GCSE results were. I wouldn't be able to tell you what my A-level results were. I had to go back and sit them 3 years later because I couldn't cope with college. So, you know, we are learning all the time. So many people are stopping their lives in their 30s and 40s and 50s and going to university and going back to college and reevaluating all themselves. So we learn our whole lives, but everything at the moment is compressed between the ages of 16 and 21. And we are told that if we fail during that period, that's our whole lives ruined. Yeah. And it isn't the case at all. It's so wrong. You know, and it comes back to that thing again about looking at the people who are less privileged, who are the ones who are really being pressured by this system, and actually how we have now people like Liz, someone who was isolated, someone who was pushed out of her part of society in terms of her children's education and all of that, and has now become a leader. So what does that say? It actually says that the weakest of us are the strongest of us. And if we work to the strengths of our weakest people, actually it makes everybody stronger and better. And that isn't necessarily about getting GCSEs or A-levels or degrees or whatever, you know, but mental health is fundamental to every human being on this planet. If we have poor mental health, we are not going to learn. We're not going to work. We are not going to provide for our families. None of that is going to happen. And the longer it goes on, the harder it's going to be to claw it back. So if you start from the very beginning, start when children start being educated at nursery, preschool, and you have those conversations about mental health, about positivity, about finding strengths in weakness and all of those kind of things, and you embed it in children as they grow older, it's going to be there fundamentally their whole lives. But we don't do that at all. We worry about what exams they're going, you know, we worry about where they're going to university when they're 4.
Yeah, it's crazy. I mean, we're league table obsessed.
Yeah.
Let's socially structure and create hierarchies and rankings and layers, social layers, so that we can manage economies better. I mean, it's just our priorities are all wrong, aren't they?
Yeah, it's all money driven, and that's the problem.
Yeah. I just want to sort of go back to what Liz said for a second, just to point out. I mean, she says that she's now able to help her SEN community and community friends and other friends that are struggling to adapt or cope with the idea of school learning, and obviously that's great. I think that just highlights one other thing which is great for mental health generally, which is helping others, that sort of supporting others.
Yeah.
As you were saying, Kieran, if you can find your strengths, and even when you've sort of been beaten down with that negativity stick and everything else through life, if we're able to find our strength and our footing and our place, and we can help others, then that's one of the best things for mental health.
Yeah.
I mean, when you're helping other people and you feel that you're making a positive difference, I mean, that is tremendous. So
it is, and it's kind of anybody that tells you that they're completely altruistic is a liar, because helping other people is transactional, because it makes you feel better about yourself.
Totally.
And it whether you are doing that for money or whether you're doing that for the buzz or whatever you're doing it for, it's transactional. So you are getting something out of it, and it's at a time like this, supporting other people is. I mean, that's my business has dropped off a cliff edge since this started. I've lost all my income for the next 3 months, 4 months, probably going forward. I was supposed to be doing a tour with Christy Forbes of Australia at the end of the year. That's now not happening because obviously, flights and all of those kind of things. So, but instead of panicking about my income, what I've done is, look, the government is helping in various different ways. Maybe not as much as they could, but it's something. I know some people are not getting anything, so I'm very lucky in what I've got. So I'm taking what I'm doing and helping as many people as I've gone back to my roots. I used to do this full time for nothing, and now I've gone back to doing it full time for nothing again, because there are so many people out there that need me and need my advice and need my support, and I'm in a position where I can give that. So why wouldn't I? It comes back to, we're very much need to re-establish communities and reconnect with our communities, and this is a really, really opportune time to do that.
Yeah, when are you getting into politics, Kieran?
Yeah, much needed.
No, not happening.
What?
Right. No, see, this is my problem. There are kind of, I mean, in terms of autism, there are many platforms in this country who I won't speak on. There are conferences that I won't go and talk to. I've been asked to, but I won't. And it's about, I don't want to become part of the system that's oppressing us. And I would rather be on the outside shouting very loudly than be on the inside and being paid and getting comfortable. I'd rather be uncomfortable and on the outside.
That makes a lot of sense. Yeah. Talking of policies and politics, I wanted to ask you. You're getting a lot of support for that statement there. I wanted to ask you, talking of policies, did you see the absolutely terrible policy that NICE were recommending about frailty and people with learning disabilities? James and I have talked about it, and we're just, I mean, it is an absolute horror show. It's just awful. I mean, I know, obviously, we all know, well, we know inside the community that autism and learning disabilities and the whole disability community is very stigmatized and discriminated against. We know that. But this is taking it to an extreme that I hoped I would never see. To suggest that if you have a learning disability, you should be rated higher on the frailty measure, frailty score, and thus be deprioritized to receive intensive care compared to somebody else. I mean, that just really sad. It really, breaks my heart.
Yeah.
And it's incredible. I know they've retracted it and they've apologized, but to even have sort of thought that was a good idea.
Yeah, but even though they retracted it, it's come out this week that several GPs practices have been giving that line. You know, they've been saying to families, "Oh, your family member will never be considered for,
Yeah.
you know,
That's traumatizing.
for hospitals or anything." You know,
there was an article on the BBC today or yesterday about GP practices that had told various community groups that to make sure that they had DNRs in place. So it's, even though they've retracted it, I mean, I don't even, to be honest, I don't even think if NICE had put it into the guidelines, and you know, if they'd not even thought about it, I think that mentality still would have been there. I think it still would have come out because we are stigmatized, we are seen as less than, and we're dehumanized all the time. And it goes to show that kind of, you know, there's two sides. We were talking so positively about the medical community and the NHS at the beginning, and then it flips around to this, which is where we're less valued as people. We're not seen as fully human to some degrees. And I wrote an article recently with a friend of mine who she's got a master's in ethics, and currently she's doing she's becoming a neurologist. And she was talking about the papers they have to study, the research papers they have to look at, and the language that's used. And there was a debate amongst her tutors openly in front of the students about what makes a human human. And basically they decided that if you lacked theory of mind, you weren't fully human.
No.
Yes, and this was happening at UCL. So you know, so I'll send you the link to the article, Chris, afterwards. But you know, this mentality is still embedded in our medical communities, in our political communities, and if you think the not your charity, obviously, but the larger charities, the charity model, which is all about this recurrent negative narrative, because that's what keeps the money coming through. You know, big charities aren't charities anymore, they're businesses, and they're businesses that need money to perpetuate. And any charity's goal should be to do itself out of business. That should be any charity's goal. But the big charities aren't like that. They're there to self-perpetuate. So they reinforce, you know, they put a few positive things in and a bit of inspiration porn and all of this kind of stuff. But ultimately it's about, let's keep it negative. Let's not make too much change, because if we make too much change, they don't need us anymore. And, you know, so all of that is just and then they're the people that advise politicians, and the medical people advise politicians. And so it's this constant cycle of negativity. Sorry, I would supposed to be positively inspiring people, and it's
really tough. I mean, the nice thing though, as James was saying, it really did have, you know, an effect. Even though they retracted it, they sent, you know, many. I mean, those are just the GP surgeries that we've heard about. Yeah, sent those letters out, DNRs, and all the rest of it. You know, it's probably far more large scale than and it possibly may have actually been implemented clinically as well. Yeah, in many instances. So
I imagine it would be. I mean, at the minute when we're looking at numbers, you know, when they're talking about rates of people that have died or people that have contracted, all they're talking about is people in hospitals that have been tested before they have died. They're not looking at care homes. They're not looking at communities. You know, they're not measuring those people, because for whatever reason, I don't know why, but you know, there was a report last night about the number of care homes where people are getting sick, and they're not getting the support they need, and the care workers aren't getting the support they need. And so those decisions to a degree are already being made, and it is always the weaker and poorer aspects of society that pay the worst toll in anything like this. And again, it comes back to those hierarchies again, in terms of the people that are in charge, have the power, have the money, whatever. You know, they're the people that are going to self-protect. Yeah. And they're going to self-protect each other before it comes down to because, you know, because it's that equity thing again. There is no equity. It's not an even playing field. It's, you know, and people are talking about this being a great leveler, and it isn't a great leveler at all, because we're seeing the black community is paying a bigger price than anyone, especially in the States, but also here, you know, the disabled community, the elderly. It's the vulnerable people, the people who are pushed to the edges of society, are the ones that are paying the biggest price for this. And the nice stuff is just, you know, the worst thing is it didn't shock me.
That is shocking in itself. Yeah, it's sad in itself, but it makes sense. It makes sense. Totally.
Well, I think it goes back to what I was saying about the training that's needed for the NHS. Even you're supposed to go to your GP to get an autism diagnosis when, if you're an adult that thinks, this suddenly makes sense to you, like it did to me. I just had a very sort of hard time with my GP because they haven't got the experience. They don't understand autism in adults. All they understand is seeing a child that's very distressed at being in front of a GP, and that's what they think autism is and looks like.
Yeah.
When they're confronted with an adult that's not doing, that's not in distress, I mean,
we need
they just don't know. They haven't got the experience, and think we need to sort of seize the opportunity after this crisis calms down to get that training in place. And I think our strengths, whatever academic level or whatever, autistic people have that lived experience, and we can all play a part in educating and training, putting in place some kind of training program.
Sorry. No, go ahead.
No, I was just going to say, I think with regards to the NHS, the mandatory training, I hate to be a kind of Debbie Downer, but I'm involved in a kind of a group that's going ahead to kind of like access the training and stuff, and we've seen what they're asking and for the timescales that they're asking for those things to be delivered in, the amount of competencies that they're looking for, the amount of things that they want into the training, the fact that they've rammed LD and autism into the same very minimal training it's, to be honest, I don't think it's going to have the impact that a lot of people are hoping it's going to have. I think it's going to barely scratch the surface, to be perfectly honest. And we were very kind of right from the very beginning, and hats off to Paula McGowan, who's done an amazing job to get this as far as she has. Absolutely incredible. But I've had conversations with her and her kind of people, and so many other people have, about engaging with the autistic community from day one and not letting the charities have their input into it and not letting it become a political football. And I think it has become a bit of a political football, to a degree. You can't ever stop that because it's going to happen. But I would love to eat my words, and I will happily eat my words, because if this turns out to be something incredible, then, I'll happily admit that I was absolutely wrong. But I very much doubt it's going to have the impact that people want it to have, which is such a shame as well, because it was such a huge opportunity.
Yeah.
Well, I don't think this organisation, Neurodiverse Nurses, is going away.
No.
They're only going to grow, and I think they're going to continue their campaigning. So, if one lot of training isn't enough, then we'll campaign for another lot and another lot and another lot. So maybe it's just the beginning of something.
Yeah, absolutely.
They're setting up, from what we heard, we're bringing out the podcast episode that we did. It'll be available sometime in May, and you'll be able to access it then and see what this guy was amazing that we spoke to.
Hero this guy is.
Yeah, and I just want to get behind this, because they're setting up a website where they're talking about some amazing stuff on there, and that everyone from the community can play their part and contribute. So I'm hoping for big things.
The key difference, though, is that he's really leading it. He's driving it. He's got that lived experience. It's not political. It's about social change. For the right reason. Whereas it sounds to me like in the case of the mandatory autism training, that it's being perhaps driven by and led by those that haven't got the right hats on. And maybe haven't really been properly talking with the autistic and being led by the autistic community, I think.
Yeah. And I mean, I know the National Autistic Task Force have fought tooth and nail to kind of had some influence over it. And actually, when you read through the competencies, you can see where they've had influence over it, which is really, really good. But again, I think it comes back to there being too many people with too many different agendas that have really kind of influenced it. But the groups like the neurodiverse nurses and stuff like that, these grassroots organisations, this is where you're gonna see the real change.
Exactly.
This is where the real lobbying happens, because that's people on the ground. That's people who know what they need, and that's people who, if they can come together with a strong enough voice, are going to fundamentally make real changes. And so I can only ever support that.
Exactly.
Yeah. We have a comment here from Sarah Lawler. She says, sadly, it shows just how poor society's understanding is of autism. Less serious, but no less offensive, was the DVLA debacle a few months back. I really do hope the current situation can be leveraged to improve people's understanding of how we live routinely, but we need to be making people aware that what they're experiencing now is a little of what we experience day in, day out, as you said, Kieran. But yeah, I mean, the DVLA debacle as well was another a debacle. Obviously, yeah, it is a little less serious than what Nice was suggesting, but it reflects again that total misunderstanding, social stigma, discrimination, and all of the issues that we're talking about, really. It's
all part of the same narrative, and it's interesting actually, because that was the GMC that were advising the DVLA as well, the General Medical Council. So it's kind of that you would think the people that would understand this the most actually understand the issues the least, and it's we've had this narrative that, it jumps back to the 1940s. We're still talking about the same things that Asperger and Kanner were talking about. And the community has moved on so far from that. Research has been left running to catch up with us, and is constantly running to catch up with us. And I think it's all fundamental to the fact that the wrong people are making the wrong decisions about us. It's, we have very little influence over our lives. Not our day-to-day lives, but the general decisions that are made about us, policy changes, things like that. And usually it's very small pockets of tokenistic people that are brought together to have input on those decisions. And usually it's kind of a prescribed kind of choose between this choice and this choice. Which one do you prefer? Without actually the conversations that need to happen. And it's all led from the front rather than from the back. And it doesn't make any sense.
Yeah, fully agree. And it creates harms, actually, doesn't it?
It does.
Yeah. Sarah just added, is it also about autistic adults knowing they're autistic and feeling safe and empowered to be open about it, to educate people from within? I think that's a really good point as well, isn't it?
Yeah.
Absolutely.
Yeah. It's one of the things that I kind of talk. Sorry, I've moved my camera and chopped my face off now. It's one of the things that I kind of talk about all the time is not only the importance of introspection, but the importance of outrospection. So if you consider that autistic children, autistic adults have traditionally been kept apart from each other because, people didn't want us to learn to become more autistic. That's traditionally what's kind of happened. We've been separated and kept away from each other. But actually, when the study in Edinburgh, the Diversity and Social Intelligence study that Sue Fletcher-Watson ran out of Edinburgh, has kind of reinforced again what the community has been talking about for so long, in that autistic people communicate brilliantly and really, really effectively if you don't put non-autistic people in the mix to confuse the issue, and that's the thing. But it's always been assumed that because communication between the autistic and the non-autistic has broken down, that it's the autistic person's fault because the non-autistic people are in the majority. So if you start looking at it through that lens, actually, things need to change fundamentally, because we are efficient communicators. We do it in our own way. We are effective at doing things that we need to do because we do it in our own way. And when we try to do it like other people, or when other people impinge their values on us, that's when the systems start to break down. So what Sarah said there is absolutely perfect, because feeling safe and empowered comes from acceptance, and you can't accept yourself if you don't understand the narrative which holds us back, if you don't understand autism, because nobody teaches autistic people about autism. You know, everybody else gets training apart from the autistic people. Even if that training is rubbish, everybody still gets it, you know. And if we are not able to see this narrative which has been given to us and that we take on for ourselves, then we're never going to be able to have a strong enough voice. And that's the principle that I kind of come from, challenging that narrative every single day and making people see that actually.
Absolutely perfectly put. I mean, I can't add anything to that. That's beautifully put, mate. James, any you want to add to that? Or
yeah, I mean, we could. This is with. I don't want to get us off track, but yeah, I think we could have conversations for days about what we would change about how diagnosis is done and all kinds of things. You know, maybe that's for another time. You know.
Yeah. Sure, but I fully agree with everything Kieran was saying. I've got a couple more comments, and then maybe we'll close up soon, because obviously it's been talking for about an hour, and
wow, gone quick.
Kieran, yeah, it's gone so quick. Nick King says, for some places or spaces, it will only ever be a tick box exercise until the majority do it properly rather than the minority. Then they can be held to account. Any thoughts on that?
Yeah, I think that, see, it kind of, you could look at all of this and say we've gone off track from the main thrust of what our conversation was supposed to be, which is about mental health. But actually, all of this is part of our mental health. Yeah. Because, you know, what Nick said there is perfect, because until people take us seriously and value us as people and see us as kind of, you know, people who are capable of providing to society and are capable of achieving, but we need to do things our way. Until people see that, our mental health is always going to be poor, because if we aren't valued, we're not ever going to be able to value ourselves properly.
Yeah.
You know, so, and then it really does come to that. It's kind of, it's not necessarily about holding people to account, but it's about making people see that what they're doing is harmful. And it's not just harming one person, it's harming swathes of communities. And even because of the narrative that kind of so many, I mean, I see autistic people talking so derogatorily about themselves every single day. And it's their understanding that autism has made them feel like that, when in actual fact, it's not. It's society's narrative of autism that's made them feel like that. And it's the lack of supports that aren't, the supports that aren't there because of that narrative that have made them feel like that, and the lack of understanding and the lack of acceptance and the constant need for them to be like everybody else because they're told that they have to be. All of these things like play into this central mental health narrative, which is, you know, and they keep throwing money at different things and support groups and post-diagnostic groups, but actually what we need is social change. That's the only thing that's really going to fundamentally going to change everything. And I think that's what Nick's really talking about there, is that changing of that ideology around the whole thing.
Yeah, fully agree. I mean, it's that, as you say, that narrative which is connected to, which creates stigma, you know, social stigma. And then one of the main consequences, I mean, there's many terrible consequences of social stigma, but one of the most poisonous for mental health is when people internalize that stigma. So those that are being targeted by the stigma, then, you know, believe it. They don't reject it. They believe it and they internalize it and they apply it to themselves, and then their mental health declines, and that's real poisons. And there is quite a bit of research that shows that you know, internalized stigma really is one of the worst things for mental health, when you really sort of, you know, don't know anything other than what, you know,
what you've been told.
What you've been told. You know, so you sort of just go with the narrative. And as you said, Kieran, it's only when we start to change that narrative and reduce that stigma can that then really be can that really go away. But of course, then you've also got some tools that you can use to prevent yourself from internally stigmatizing yourself. But the best way is just to change the narrative. Okay, so then we've got a couple more comments. Okay, this one's for us, James. Hello, this is Natalie Morrow. Hello, what does the London Autism Group Charity do? And do you think more business needs to be autistic trained? And what are your thoughts on how autism is looked at in the media, like TV shows and movies? Okay, all right, we have to talk about this all day.
That's a whole other conversation, that one, isn't it?
Great questions. So I'll summarize the first bit about what the charity does. So James and I founded the charity a couple of years ago. We're still a small charity. We originally produced the London Autism Group, which is a Facebook-based support group, which has done really, really well. But we're very, obviously we're fully on board with all of the neurodiversity principles. We're, very, very, autistic led, and we're all about that. And the Facebook group has been, as a consequence, highly successful. But we wanted to go further because a Facebook group is great, but it's just a Facebook group. So we wanted to build something on top of that, and produce a charity in which we could then have the leverage to create, as what Kieran's talking about, more change the social narrative, reduce autism stigma and discrimination, improve autistic people's mental health, and also parents and carers of autistic people, their mental health, and also autistic parents and carers, because of course everybody can be autistic. So it's about improving. So what we do is we do things like this, the live stream. We have the Facebook group. We also have something called the Autism Podcast, in which we interview people and have interesting conversations, because we really believe in the idea that discourse is a good, strong way of really triggering social change and improving, understanding and all the rest of it. So we have the podcast, the group, we do these live streams. We've also got a couple of initiatives that we're about to launch to support the mental health of the wider community, autism community, in the wider sense as well. So we're small, but we're building. Anything you want to add to that, James? If I left anything out?
Do you want to talk about Solace?
Oh, Solace, of course, Solace, yes. Okay, Solace is something that is a mental health intervention for parents and carers of recently diagnosed autistic children. And the idea is that, so it's something that I developed at my university. I'm a university academic. And the idea is that if we can teach, well, not teach, but really guide parents and carers who are new into this whole world about actually the beauty in autism and the beauty in neurodiversity, and actually get them right from the beginning to reject misconceptions, stereotypes, autism stigma. Actually, what will happen is that their mental health will be improved, their hope and empowerment will be improved, and then in turn, their ability to care and parent and protect their child and advocate for their child will improve. So the idea is that we do this. This is the sort of principle, the point of Solace. This is the sort of underlying theory, because stigma really does, as we've been talking about, really does compound mental health. So if you can resist the stigma and replace it with more healthier, more appropriate, more correct ways of thinking, then better mental health follows. So it's really for new parents and carers, and we've been running that in North London, but we're about to expand in other areas of London to do that. And the main aim is really to boost parent and carer mental health right at the beginning, because that beginning juncture, when you're really new into it, is when you're really most vulnerable to misconceptions and your mental health is really poor. So, I mean, obviously there are many points where you're vulnerable, but that early entry point is something that we're focusing on. So we've been doing that. It's a group-based psychosocial intervention. And as I said, the principles of that, but also we want to use it as a platform for building social support, because of obviously isolation and loneliness is another big thing. So it's about actually bringing people that are in a shared identify with each other's situation, that live locally to each other, wouldn't have known each other, and then building this positive journey together. And it's been really successful so far. We're pretty proud of it. Obviously, COVID-19 has changed things quite a bit, and we've had to delay our next run of it. We're going to run it in September. Again, we're hoping September, October, once this is, once the situation's improved. So we do that as well.
Sounds brilliant.
Yeah, thanks, Kieran. It's not too bad. I'm pretty proud of it. Yeah. And very quickly, do you think more businesses need to be autistic trained? And what are your thoughts on how autism looks like in the media? I would say businesses definitely aren't neurodiverse friendly enough. They're not leveraging autistic potential. I just think, the things that we've been talking about today should be in the business sphere as well. But one of the big problems is that because of the stigma, people don't feel like they want to disclose their identity, and therefore, it's hidden, and businesses may not know that, the situation is happening and how to support. So that's a problem, but that's because of the stigma and the internalized stigma, as we talked about before. So I think there's a lot of work to be done in that area. And I think if it can be improved, you're going to see businesses do much better, society benefit, and everyone's well-being benefit as a consequence. But there's loads more to do on that front. Would you agree, guys?
Yeah, I think Kieran's done a lot of work with that avenue, with consultancy and things like that.
Yeah, I mean, a lot of my focus has been on organisations that actually run autism services. Okay. So I've done some work with kind of HR companies and stuff like that, but it's ironic really that even those organisations that run autism services are really, really poor at understanding autism. Yeah. It's as employers, they're not great, and bizarrely, as you guys will probably know, kind of anecdotally, lots of undiagnosed autistic people are drawn to autism support services as jobs and being in those kind of caring roles and supporting roles. And it's really interesting, the fact that so many organizations don't know how many autistic people they actually have on their workforce, and kind of how many people are struggling on their workforce as well. It's counterintuitive to a business model as well, which really doesn't make sense to me, because if you've got workers that aren't happy, they're not going to be as productive. So it pays to kind of invest in them, and
morale is everything.
Absolutely.
Yeah. And just very, very briefly, how any thoughts on how autism is in the media, portrayed in the media TV shows? Any thoughts, Kai?
I think this video is an advert for what's wrong with autism in the media, because we are me and James are two white guys. Are you Cypriot, Chris?
Greek Cypriot,
yeah, you are. So kind of me and James are terrible for this, because we are the stereotypes. It's white boys, and any kind of film about autism or TV program about autism, you either have genius white children, or you have the kind of the Dustin Hoffman kind of Rain Man kind of, who wasn't even autistic, but we'll not go there. Or it's the kind of rocking, screaming child in the corner. There's no middle ground. There's no women. There's no non-binary people. There's no people who present atypically. It's all very much fundamentally the typical white boy.
Stereotypes.
Yeah, it is. It's stereotypes, and we need more programs where there are multiple open autistic characters. And that would be a real game changer if it was people from different backgrounds and that kind of thing. That would be a huge thing.
I think the media actually have a huge role to play in our mission of improving social narratives. They've got a big responsibility, and a huge role. And I'd love it if they were more connected with autistic voices and really listening and understanding, and also bringing them in as well. Into their teams.
It's quite ironic, because you think the number of characters that you get, like the discussions happen like this all the time in like the on social media amongst the autistic community, like which people from which programs are autistic but they're not openly autistic or they're not diagnosed, and so many lead characters from like major programs fit autistic tropes, you know. So it's almost like they're writing about us but they don't know that they're writing about us. So there are positive representations of autistic people in the media but they're not deliberate. And that's the worst. You look at the Big Bang Theory. I mean, it's obviously Sheldon Cooper is the autistic one in that program, but actually half that cast are representations of autistic characters. They're just undiagnosed and unrecognized. So it's kind of, but they're not the ones that are talked about. So it's the atypical people that need to be recognized, and obviously the women, and obviously non-binary people and people of color and all of those kind of things, because we're everywhere and we're all people. We're not just some people from some pockets of communities, and that's what's missed.
Yeah, I think there needs to be a lot more publicity about the autistic cultural things that are being produced. Like there's a thing called Aut Act Theatre that produced a play called The Duck.
Yes,
which is about a adult woman's diagnosis. Fantastic piece of theatre, and they've recently for the lockdown period they've produced an audio recording that people can download. I'd highly recommend people go to the Aut Act website and do that. But there's a lot of autistic culture that never gets portrayed in the media that I think needs, they could certainly do that, and that would do a lot of the job, that we're talking about, of educating. And
I think it's
forward.
I think it's really ironic because it kind of when actually the stuff with the NICE guidelines came out, a very good friend of mine said to me, so if they let all the autistic people die, who fixes the internet when it breaks? And you look around the world around us, and so much of our world is dependent on, at the very least, neurodivergent creations and thinking, out of the box thinking and ingenuity. And you look in art, you look in authors, media, film directors. Very often film directors are very obvious. I'm thinking J.J. Abrams here, people who are not diagnosing anyone, but people who very obviously have autistic characteristics but maybe don't recognize themselves. So our whole world is pivoted around neurodivergent and autistic culture, but it's never talked about. It's what James has just said there is perfect, because it's never ever looked at.
Spot on, fully agree. Thank you, Katie McMaster, for your lovely comment there. You guys talk so much sense. Fascinating talk. Thank you. We'll take it. We'll take it. Jane Green Edsau says, hello, psychosomatic stigma for physical health affects mental health. Yes, so spot on, correct. Everything is really connected. I fully agree. Physical health and mental health are completely connected, of course. When your physical health is poor, then that obviously has an impact on your mental health. That can have a big impact on mental health, can't it? And the whole mix between stigmatizing yourself, internalizing your stigma, all plays into a vicious cycle. So fully agree. Jane Macaulay says, hello, frustrated I missed this live. Sure, it's been brilliant. My little person has been struggling with his mental health, and having gotten back up there has taken a massive downturn with the lockdown. I'm sorry to hear that, Jane. Any thoughts or any comments on that, guys? And then maybe we'll wrap it up after that.
I think it's difficult, probably more difficult for our children at the moment than it is for anybody. All of our routines have gone, all of our normality has gone, but for many of our children, the ones that are able to access education and things like that. They've been ripped away from their friends. They've been ripped away from even those that were unhappy in school. It was still a routine to a degree. So it's all been taken away, and now all of a sudden schools become the kitchen table or the dining room table, and they're not seeing their friends. They're not able to do the things that they would normally do. And it would be really, really easy right now to kind of withdraw and disengage from everything. And lose yourself amongst, as a child, it will be really easy to do that, kind of just lose yourself in whatever it is that you want to do. And I think we have to take into account that, firstly, like we've said all the way through this, education is not the most important thing at the moment. So taking all of those demands and all that pressure off. I mean, at the minute, I write and talk a lot about autistic masking and autistic burnout. And at the minute, I am treating my 3 children like they are in autistic burnout. So I'm reducing all demands. I'm letting them engage in sensorially with things that they need to do. I'm just letting them basically run free. We're coming together as a family. We're doing educational things in terms of gardening, talking about what's going on in the news. We're doing a lot of art together, a lot of drawing. My 3 kids all love drawing. So it's kind of, I'm taking school out of the equation, but keeping the educational value of stuff there.
Yeah.
And I think that's really key to kind of, getting down on the floor with your children and doing with them what they want to do. If they want to play on their tablet, play on the tablet with them, sit next to them, talk about what they're doing, engage with them in that way on their level and follow their interests. And I think that's the real fundamental way we're only going to navigate through this. And I know that's very generalized, because obviously I don't know the specific situation of what's going on with Jane's child, but it's kind of, as a general rule, that's how we need to be as parents at the minute. We need to be on the floor on the same level as our children and just following their lead right now, because it's too much. It's too overwhelming for us as adults. So what's it like for a child that really doesn't understand what's going on?
Yeah, fully agree. Jane, just try your best. Don't blame yourself at all. Look after your own well-being, because as we've been saying, your own well-being is going to really sort of connect with your son's well-being. And as Kieran says, I fully agree. Try and find what he loves, find his passion, get into his world, and really prioritize his well-being and happiness. And take any wins. I would say take any wins you get. Reflect on those wins, and try and see the positives and the potential in the situation, the opportunities to learn more about your son, about what works, what doesn't work, and have hope. I think would be the last thing I would say. Don't think that this is just going to completely defeat you. Believe that you've got this, and you can connect with the community, as we said earlier. Draw support from us, and we can beat this together, and you're going to be all right. Just lastly, Laurel Dubbridge says thank you. So thank you for that, Laurel. And then we've got quickly just Carol Rutherford, just come in at the end of this, having been taking my daily exercise. Just wanted to say that we're having a live chat 2 hours a day, Monday to Friday, to support the emotional well-being of autistic adults in Sunderland and South Tyneside. We are being autism in aim in mind. Oh, that sounds wonderful. That's great. I mean, it's these kinds of chats, everybody, just the community sort of just supporting each other, putting emotional well-being first. That sounds really wonderful. So thanks for advertising that. And I hope your daily exercise was therapeutic. So, Kieran, just to say a big thank you. Is there anything else you'd like to add or say?
I just want people to kind of reach out in whatever way they can to other people and not be alone in this. I think that's it. We don't know how long it's going to go on for, but we will come out the other side of this, and we can come out the other side of this. And I think it's really, really key to remember that things might look different, and that's scary. But at the end of the day, if we can kind of build on our community strengths and build on our contacts with other people, now is the time to do it more than ever. And that's going to help make things stronger in the future.
Yeah, fully agree. James, anything?
I'd just like to echo that, really. I think there's sort of, as grim as it's seemed, we've seen people come together, and we're all certainly going to be here for people, you know, to reach out to, I think if we can, we'll all definitely come together, and we'll all get through this together, you know. And that's and going forward, you know, there's a lot of positive change that can come from this.
Yeah, when this does end, I think we need to perhaps have a chat, all of us, and think about how we can push forwards in the ways that we've been describing. Yeah,
I'd love to.
Okay, so thanks again. It's really been wonderful, and you know, take care of yourself, Kieran, and your family, and
You too, guys.
let us know if you ever need anything.
Yeah, definitely.
Yeah, and yeah, that's it from us. So thanks again. Take care.
Thank you.
Thank you, Kieran. Thank you.